Taking a look this morning at the state's COVID-19 numbers, Georgia hospitals feeling that strain more and more as we see another spike in hospitalizations. So the state reporting nearly 200 more active patients just yesterday, just the day after we saw about the same increase. This as we saw nearly 5,100 new cases. The numbers are only expected to rise this coming week. And the U.S. surpassing another grim milestone. According to NBC News, more than 350,000 lives have now been lost because of the pandemic. As of now, the U.S. has more than 20 million confirmed coronavirus cases. And we are following breaking news overseas. The UK is adding more ammunition in its fight against COVID-19 by giving out the first shots of the vaccine created by Oxford University and pharmaceutical giant AstraZeneca. Officials say the UK has more than 500,000 doses of this vaccine. Meanwhile, the FDA is meeting this week to consider giving half doses of Moderna's COVID-19 vaccine to people ages 18 to 55. The head of Operation Warp Speed says clinical data shows the vaccine can be just as effective at half doses in that age group. U.S. vaccine chief says the move could make the coronavirus vaccine available to twice as many people under the age of 55. The effort to roll out the vaccine has been slower than expected. And according to this vaccine tracking map right here from the CDC, Georgia has one of the lowest vaccination rates in the country right now in proportion to population. As of Sunday, the CDC says our state has received more than 445,000 doses, but they're reporting less than 17% of those doses have been administered. That includes both Moderna and Pfizer vaccines. And last week, state leaders announced they plan to expand the vaccine rollout, but could not specifically say how they plan to do that. Within the next 2 weeks, the Department of Public Health says people 65 and older will be eligible for a dose. Police officers and firefighters are also being added to this list. They say they also plan to open mass vaccination clinics.